Good morning and welcome back to it, guys, your Wednesday edition of the Now Morning Show. And we're heading to the East. The Eastern Regional Health Authority is the largest of the 5 health authorities in Trinidad and Tobago, serving some 112,000 persons, give or take. And perhaps that's why their health fair is not just a fair, but a festival. It is happening on the 28th of October in Sangre Grande. And this morning, to tell me more about it, I am joined by Penny Ramlogan-Darbro. I almost forgot. She is the Senior District Health Visitor, and we'll get into what exactly that means, as well as Dr. Jamelia Augustine, the County Medical Officer of Health. Ladies, good morning and welcome.
Good morning. Thank you for having us.
It is a pleasure to have you because, I mean, when you have a festival as opposed to just a walk or health fair, it means grand things.
Yes.
But as we said, it is a grand number. The Eastern Regional Health Authority serves a number of districts, right?
Yes.
So in the case of this one, how do we decide how we're going to go about satisfying the needs of all of these persons? Dr. Augustine, what did the inspiration or the drive for this particular festival come from?
So thank you, Ayanka, for the question. Good morning, viewers and listeners of the program. So I think that almost everyone here knows someone with a non-communicable disease, high blood pressure, diabetes, and so forth. And so the inspiration behind this festival was to really increase awareness of NCDs and assist and empower our clients to better manage their chronic disease and also prevent the development of same. And we want to also improve persons' attitudes towards a healthier lifestyle and physical activity as well. And we also want to increase access to healthcare services. So we're bringing everything that the clients need straight to them.
Sounds like a tall order, though.
It is.
Tell me what that looks like. What exactly would the health fair or festival look like?
Okay, so before we continue, just allow me to give a little brief about
Sure.
how our health facilities span from northeast Matalot, as far as Matalot, and to southeast Guayari. So you can see it's quite a rural population.
So I'm getting a little trouble with your audio. I don't know if it's that you're not speaking loudly enough. She is a very soft-spoken person.
Naturally, yes, I am. Are you hearing better?
We will continue for a bit. But you're saying that you're going from as far as Matlot to...
No, so that's the health facilities or the area that we are responsible in ERHA for the delivery of healthcare services. So it's quite a rural population.
Gotcha.
Right? One of the things is that with this program, we would have engaged all the communities. I know you would have spoken to how we are going to direct the health festival. So we have engaged all the facilities, and that would have meant that we engage transportation and so forth to bring them to this one venue.
And Doctor, I want you to give me then and you alluded to some of them, some of the actual activities that will take place on that day.
We have so much activities.
Yeah, you definitely have a long
for
list.
everyone of all ages. So we're going to be starting off the morning with a health walk and run, and that begins at Bliss Car Park in Sangre Grande, and we go all the way into the heart of Sangre Grande, and from there we come back to Bliss Car Park. At that site, we will then be having aerobic session and Zumba, and the clients will be getting water and their fruits and so forth along the process, along the journey. And at that point, we will then start the exciting stuff for the day. Yeah, so we'll be getting warmed up with our walk and run, and then we'll be jumping in with our kids zone. We have an obstacle course for the kids, we have a bouncy castle, we have face painting, we have lots of activities for the kids. There will, of course, be our clinical services, so we have counseling services provided by our medical social worker department. We have sessions that will be provided by doctors on site, nurses on site. We have our Know Your Numbers initiative where persons can be screened for high blood pressure, diabetes, so they will get their blood pressure checked, their blood sugar checked, their BMI checked.
The numbers behind those.
Yes.
I get it.
And then we have specifically for the ladies, pap smears and breast examinations. We're also doing mammography referrals And we are not forgetting our gentlemen. They will also have prostate screening as well.
Wow.
So that's just just a few of the items. I know that Nurse Penny can probably talk about more of the stuff that we have.
Your hands full on that event, because that is a number of services that you usually want to schedule appointments well in advance for. So I understand the intention, bringing it to the persons. But in the case of this particular health fair, tell me a little bit about the importance of making sure that happens. You were talking about the rural communities that you serve, so I imagine it's something to do with that.
Okay, thanks for the question. So yes, because it's a rural community, the fact is that the public and our clients, they always expect us to have this one-on-one relationship with them. We usually go out to them. Health fairs and, well, in this term, health festivals are things that we like to do to engage the public. We get a better response as opposed to the normal relationship within the facilities. You know, it gives them that opportunity to come and experience health in a different arena. One of the things is this, we are going with this TT Moves initiative, which is let's move our wellness journey together. And that ties in a lot with our ERHA core values like partnership, shared ownership, quality healthcare, universal access to health. You know, so these, because we are moving under that slogan, we're really trying. Most of the services, as you would have heard from Dr. Augustine, would have been targeted towards empowering our clients.
Right, making sure they know their numbers so they can actually manage things better, and of course equipping them with the access to the doctors and the support like nurses like you to make sure that happens. I guess it's a CD festival coming together, man. But that is, like I said, a tall order. So let's get the specifics, doctor, on times and locations before we go any further. You did mention it's at a car park, so where exactly are we going to?
Yes, so we're going to the Bliss Plaza car park. It's a large area. It can accommodate hundreds of persons. So we're hoping for a well turnout at the event. And one more thing I wanted to mention, in addition to the services, is our wellness services, which is really what we're trying to focus on in terms of primary care. And so we'll be having a focus on exercise and wellness, and we have our chronic disease support group, which will be even leading one of the booths with a food demonstration as well. Yes, so we have lots in store. And it will be held, like I said, the Bliss car park, that's in Sangre Grande, easy to access. It's close to the licensing office on the Eastern Main Road.
I know exactly where that is actually. And in terms of times then, because there's so much happening, this is a whole day thing.
Yes.
We're looking at 9 a.m. as a start time?
So we are having our walk and run from 6 a.m.
Right.
Yes, and we'll be doing this.
Look at me counting on the run.
We'll be starting and ending at Bliss car park, and we'll be continuing the day's activities from 9 a.m. to 2 p.m. at the same venue.
Confirm for me, in terms of registration or participation in that walk or run, is there a website or deadlines we need to pay attention to?
Yes, so there is a website, and it's www.erha.co.tt, and we have lots of giveaways for that. So the first 50 registrants on the day will be getting a free t-shirt, and up to the first 200 persons to complete the walk and run will be getting a medal.
Now, I'm not even going to fool myself because I don't think I can participate in any walk or run, but it doesn't sound like it's a difficult terrain. This is something anybody, amateurs, everybody can be part of, right?
So we're encouraging everyone to come out. The elderly, the young women coming with their babies, the fathers, the gentlemen coming to support along the route as well. It's open to every and anyone. We really want the community to engage with us on this health festival.
As you mentioned, the community's willingness to engage. Let's talk about the collaboration with the members of the community, because as much as you all are providing services and equipping persons within these regions to do that, I imagine it takes some manpower and some support.
Yes.
What does that look like for you guys?
Oh, wow. So Nurse Penny really, she is very, very involved in organizing the team to go out and to get persons interested from the community as well. So we have our chronic disease support groups. We also have our wellness groups where we have exercise activities that span a number of health facilities. So we have them all the way down south in Brothers Road, in Mayaro, in Rio Claro Health Center. And on the northeastern side, we have our active groups in Matura and Sangre Grande Enhanced Health Center. And from the first week in November, we'll be expanding that service into Valencia Outreach Center and Manzanilla Outreach Center. Thanks to our partnership, we are fostered with the Trinidad and Tobago Defense Force, so they'll be offering their services by providing some physical trainers. So, yeah.
Well, big things means a big festival.
Yes.
And so I'm going to wish you ladies a lot of luck, although I don't think you need it. It sounds like it's going to be excellent, and it's a beautiful way not just to give back to the community, but to empower the persons within it.
Yes.
So guys, you are heading to Sangre Grande on the 28th of October for the ERHA Health Walk and Health Festival, where there's something for everyone as they make a big dent in tackling the non-communicable diseases challenge that Trinidad and Tobago faces. We are the Now Morning Show, and we have even more events for you to add to your calendar, but you have to stick around to find out what they are. We'll be back after these messages.